Okay, hi guys. So we made it through today. We went for our consult. It was kind of all official and everything, and the doctor actually didn't see. We were put in a patient room, and then sorry, I'm trying to keep so many. And then he came in and got us and took us to his office, which I felt like I was like in an attorney's office. It was really weird. There was pictures of babies all over the place, which was so cute. So yeah, we did like all the pre-talk stuff. He's like, you definitely want to do IVF and all that. So we said yeah, and he answered just a few questions. Basically health background. My husband had to have blood work drawn for cystic fibrosis to see if he's a carrier, and then I'll have mine done next Wednesday. They want to do all mine at the same time, and yeah, Wednesday. Yeah. And then the great news is we thought we were going to have to wait till like July or August, which we still might have to wait till July. We're not sure yet, depending on my cycle. Because our lab at the hospital shuts down once a year for maintenance to do quality control, which is good actually. And it falls right at the end of June into the beginning of July. So we're trying to get everything done through May. But they make you go through this patient orientation first, the IVF patient orientation, and that's not till the 22nd, so that's in 3 weeks, and then my husband's surgery is in 4 weeks, and so we're on the right track. So if I, start at the end of May, like the very end of May, we might be a go for June, which would be wonderful, because I really don't want to wait till July or August. And then we also found out today that even though my husband's procedure is covered by insurance, the actual cryopreservation freezing thing that they do with the sperm is not. So we have to pay for that. But good news is it includes the freezing in a year of storing whatever we don't use, and it's only $263 out of pocket, which is no big deal, considering the price of what mine is later. So yeah, we found all that out. They actually weren't even going to schedule me for the sonohistogram until like June, but because they have to do it between 10 and 15, day 10 and day 15-ish of your cycle. Well, luckily I'm on day 10 now, so next week I'll be having that done. And they didn't know if they were giving me a hard time wanting me to do the orientation first before we started any of the testing. But I really pushed. So my advice to you is there was no reason why they couldn't do it. Do you know what I mean? Like, I'm right on the perfect time. It would save us a month. So I really pushed for it, and it worked for us. I was heard. I mean, they really tried for me. I mean, a couple people told me absolutely not. And then whenever the lady called me, to set us up for orientation, I said, listen, she does this sonohistogram scheduling too. I said, can you please, since I'm like right there right now, can we just do this and get it done? So hopefully we can save a month's time. And I'm sure everybody's wondering why I'm rushing. I'm very impatient. Plus in July, that's pretty much the sum of it. I'm impatient. But if we'd have to wait till July, I have several trips to make, and we'll be driving to South Carolina twice, and I have to go, about 4 hours out east. And we live in Pennsylvania, so if anybody's wondering, they're big trips. My husband's was a Marine, is a Marine, once a Marine, always a Marine. So we're going down to Paris Island when we take his daughters back down to their moms in South Carolina. So it'd be nice to not have to worry about doing all of this at the time that they're up here, because that's really not fair to them either. So, plus all the traveling. So I'm really pushing to get this done before the lab shuts down, which I think it shuts down the 25th of June. So if I start at the end of May, we should be good. We haven't found out anything else for financially through ARC. I guess that's all covered at orientation. But I'm kind of nervous about that part. So in the meantime, over the next couple weeks, I'm really going to look into other options, other financing options. We still want to use the ARC program because they give you 2 tries at it. And you can do that. Like I say, we got a personal loan, and then paid ARCs program. It's like going on vacation on a cruise. It's all inclusive. Like, you just, rather than financing it through ARC and using their program, you can actually pay and still use the program, which is great. And then I also found out that my physician does not use. Sorry, my dog and my pig were fighting earlier. I'm making sure they're not doing that now. Does not typically use the Lupron protocol, so I won't have to worry about paying for that either. So, and the Follistim's covered. So I'm hoping that it's just going to be minimal out-of-pocket costs for the medications. And if anybody's looking into doing this, I would say don't wait, because a lot of places make you go through a orientation first. So you could always have your appointment, go through the orientation, and then if you don't want to start right away, that's fine. But what if your lab shuts down like ours is? So now we're kind of in a time crunch. I really wish I would have called a couple months ago to have this done. That way we weren't rushing, and there's like a cutoff of when I can start, and it's as opposed, I either get, I don't know what they're doing. I either get my period at the end of May, or we're going to have to wait until July. Not that anybody really wants to hear that, but that's how it works. The other good news is I asked, a lot of people I've seen here have to take birth control pills first to suppress them, which I guess is what the Lupron does too, and I don't have to do that, so that's great. So that kind of skips a step. So typically I'll only be on drug therapy for like 14 days, he said, total. So that's wonderful. If anybody has any questions or comments or advice on financing, please either send me a message or put it in the comments. And it's really all I have to update. It's really good news. I'm really, like I said, just really push for what you want, because all they can do is tell you no. You know what I mean? And like 2 people told me no, and I still pushed. And so the person that schedules actually talked to their office and got it done for me. So we're just waiting. I have to go in. I'm not allowed to eat. I go in next Wednesday. So a week from today, I'll be getting this on a histogram and the my blood work portion done. And then we'll go from there, and hopefully everything just goes right as scheduled. So I probably won't update. If I do update, it'll be something to do with insurance and money and things like that. And we did ask him, I don't know if he was joking or not, we asked if he could implant 2, and he was like, no, why do you want to do that? And we're like, well, we really want, to up our chances, and it being, I'm not opposed to having twins, and neither is my husband, so. Emmy, come on. So, there they come. So he was like, no, why would you want to do that? And I think he was just joking with us. I hope so, because I read that if you implant 2, it ups your chances by like 10 to 15%. So that'd be great. But if anybody has any questions, comments, advice, please leave it in the comments. And I still haven't tried the magic bullet that I was talking about the other day. I'm going to try it tonight. We're going to make protein shakes. He also told me to start, I start on prenatals tomorrow too, and folic acid, which I already have in the house because I'd bought them a while back for my hair, which is all a disaster now. So yeah, I'm going to upload a picture of my lovely husband, real quick. I'll tell you what he did. I'll put it as the picture at the end of the video. I had this dress on, so I had to wear a strapless bra. Well, it was the one I actually wore in our wedding, and it's a bit tight now. And whenever I got I had an exam done, so whenever I just put it back on, my husband was looking at my bra, and he's like, what are these? And I guess for my wedding dress, I needed them to stand up a little better. So I'll show you what he did. I told him to take them out. And I think they're in my purse. Yeah, they are. So he puts them... They're right here. These were in my bra, like for push-up. And he put them on his ears. And it's actually a pretty funny picture. So he amuses me when we're in the doctor's offices. So that's where we're at right now. And I'll put that picture up. And yeah, have a great rest of the week. Bye.